Hello, everybody. Papa Jack here from Advantage.com, your source for some easy to understand explanations about Medicare and Medicare health plans. Today, we'll be talking about the donut hole. Technically, the donut hole went away in 2020, so what we should be focusing on are the different prescription drug cost phases. There are four specific phases in prescription drug costs, and the first being deductible, then the initial cost, then the coverage gap, which used to be known as the donut hole, and finally the catastrophic phase. The important thing to know right off the bat is not everybody goes through all four phases. Phase one, the deductible phase. You know, when I was younger, I had a buddy who used to say that if was the biggest word in the dictionary. And when it comes to your prescription drugs, it is true. If you have a deductible, you will pay every penny of that deductible before your insurance company even considers paying their portion. The next phase is known as the initial coverage phase, and you will pay a copay in either a percentage or a fixed amount of money. You will stay in this phase until you reach a threshold of $4,020. Now that will include the money that you paid in deductibles if you had one, or in your copays. But in addition, they consider the money that your drug company paid. Now, you may have a tier 3 drug that's costing you $47 a month, but your insurance company might be paying an additional $400 a month or more. So you have to add all that money together, and when you reach the $4,020 mark, you will advance to the next phase. The next phase, of course, is the coverage gap, which a lot of people still refer to as the donut hole. Again, you've reached this phase because you hit a threshold of $4,020. You will pay 25% of the cost of your medication during this phase. That includes both generic medicine and brand name medicine. The fourth and final phase, of course, is the catastrophic phase. Now you're coming out of the donut hole or the coverage gap, and you're going to reach a threshold of $6,350. Again, that's a combination of your deductible, your co-payments, and what your insurance company has been paying. But once you reach this phase, your cost of drugs goes down dramatically. For instance, in 2020, generic drug can cost you as little as $3.60, and you may pay as high as 5% of the cost of a brand name drug, but that certainly is a lot cheaper than what you were paying in the previous phase. All right, so there you have the four different phases of prescription drugs. You can see that it's very important that you understand your drug plan. If you have original Medicare, that does not include a drug plan, so you'll need a standalone drug plan. If you have a Medicare supplement plan, that also does not include a drug plan, so you need to have a standalone drug plan. If you have a Medicare Advantage plan, there's a good chance that it includes your drugs, but there are some that do not include a drug. So, and even if it does include drugs, you want to make sure that that drug formulary, which means the drugs that are included in that plan, meet your needs. This is Jack McGlenn of Advantage.com. You can find some written documents on what we just talked about on the website, and there are different ways to get a hold of me. Please like and share this. Make some comments, good or bad, let me know, and I'm hoping you have a fantastic day. Thanks.